Okay, Handel. Yesterday, 10th of February, you came for your apparatus removal, Ilizarov-Veklich apparatus removal. And yesterday you have had the apparatus removal.
Correct.
And right now, tomorrow, you will go home and your treatment at the time is finished. And 2 more months you should avoid like running, jumping, and heavy lifting.
Okay.
Yes, and after that you have any activities without any limitations.
Great.
So right now we try to explain and tell people about your experience. For 2 months you stayed home. How was your recovery and all the situations? So could please tell in details as much as possible from the moment you come home and till the moment you come for the removal.
Yeah. I think the most incredible thing about this is not only the straight legs, but how fast the time's gone by, because it seems like I was just here having the procedure. So it was really nice after I had the procedure here back in November. I went home December 1st, and I came back yesterday, February the 10th, for the removal. And when I got to the Ukraine, I had another good experience with the flight. My flights were on time, and Pavel met me at the airport with the driver, so it was good to see them again. And we came to the clinic, and within 2 hours, Dr.Veklich had me ready to have the apparatus removal, and so I did, and I had the option to have the anesthesia or not. And so I thought, well, how painful is this going to be? And Dr. Veklich told me that if I just, that he'll have the apparatus removed with no pain. And it was true. There was no pain. I was just nervous about it because I didn't know what to expect. But I would tell anybody that the apparatus removal's quite easy and not painful, and that I was very pleased with that. And so there was no pain after the removal either. It was very comfortable, and it was very comforting afterwards. So I came to this room and I needed to lay down because you want to take pressure off the areas where the apparatus was removed, and so they bandaged up the areas. And I laid down and had a comfortable night last night. And so today, it's the 11th of February, and I go home tomorrow. So it's a quick procedure to have the apparatus removed, and it's incredible seeing my legs without the apparatus. They're so nice and straight. They look a lot different without the apparatus. Even though they're straight, they just look a lot better. And so you feel a sense of accomplishment in all that you've gone through, and realizing that it really didn't take that long, and it was a lot of fun to go through that experience. And did you want me to tell you about home?
Yeah, the most important is the question is people, because some of the people comes for 2 weeks and then back home, and after that come in 2.5 months. Some people needs to come if there is a slowly correction, come for 1 month, and after that in 2 months come for the apparatus removal.
Absolutely.
So if it's possible, just share your experience about your stay at home in US.
Okay.
And your recovery at home.
Well, I would like to tell the people viewing this that my trip home from the clinic when I originally had my procedure was very comfortable, and the airlines were very accommodating. I had the slow correction, and I stayed in the hospital here for about a month. Again, the time went very quickly, but due to my age and the severity of my correction, I needed the slow correction. It was the best option for me. But I have talked to people who had the faster correction and know of them, and so it does vary. But for me, a month in the clinic followed by 2 months at home, the 2 months went by very nicely, and I made a progression. When I got home, I had a wheelchair, a walker, and crutches, and a shower chair waiting for me. and I used those progressively, very quickly. I used the wheelchair to be careful with my legs at first and get used to the idea that, you know, I'm in a new surrounding and my mobility was important to get around the house safely. And then when I got the strength and the confidence, as each day I would use my walker a little bit, I would go further and further and further. And so after the first few days, I didn't use my wheelchair at all because I could go the distances comfortably and feel good using my walker. And that was really exciting, to finally navigate my house and even outside a bit using my walker. And then one day, just within a week and a half of being home, I started using my crutches and bearing a lot of weight down on my legs with very little discomfort. And that was very progressive as well. I recall that within 2.5 weeks of being home for the 2 months, I was getting around pretty good. By week 3 and 4, I would often walk a bit without my crutches even. And then so for longer distances I would use my crutches. And then eventually I just didn't use them at all. So I've been without my crutches for a little over a month before coming here. And it's been a nice, gentle recovery. I've had no issues as far as, you know, pain or not having balance or strength. Because when you leave here, your legs are a little weaker because you've had a procedure and you've been in bed for a while. So your legs atrophy, they become a little smaller. So as you're rebuilding that strength, you just need to be careful and make sure you don't fall or get carried away and try to do more than